this episode of Horse Shelter Heroes.
We are currently doing intake on the last group of buyout horses.
This mare was down in the trailer when she arrived. Pretty concerned about her. Good baby. You guys, that is just heartbreaking.
We have a complete femoral fracture. This is the top part and the bottom part, and they're not even lined up with one another. Got a super heavy roundworm burden.
Yeah.
Huh? That's real gross. I'm sorry.
Today is an exciting day because she is finally ready to be turned out.
You don't want to miss a single second of Shelter Heroes.
John, what you doing?
Trying to fix Face Computer. It decided to just die on us when we come back from Monday, and it's still cold out there. It's still, let's see if you can see. It is still cold and icy. It's starting to melt finally, but it's been a week last week and a day today. So again, I'm all alone again, but I'm trying to fix Face Computer so that tomorrow we can all be ready and have a normal day, because it's I'm ready for that time where the snow is just gone.
Dawn, you want to talk about this morning? What happened?
Yeah, I've been in the ditch since 7:45 this morning on the S-curves down the road.
Kind of icy.
Yeah, 3 people tried to pull me out and got stuck. So it's been a fun morning.
Yay!
Hey Angela, what you doing?
Well, I'm just doing a few things here. Vets are up in quarantine doing intake. We had a very icy road this morning, so Keith and Corey were helping some staff members actually get to work. So it's just been a little bit of a crazy morning, just working on getting everything done and making sure everybody's safe.
We are currently doing, I guess you could call it intake on the last group of buyout horses. They are getting all the things. We kind of held off on doing the main intake. We did do an initial assessment to make sure that no one was like in pain, and we did communicate with Dr. Lydia during that time. But right now we're doing our more detailed intake assessment, and each horse is getting a vet exam. We're also pulling coggins and giving microchips, all the things. So that's what we're doing today.
If a horse doesn't have any teeth, how can you say what age he is?
You can't. It's non-specific, but horses are brachydonts. So their teeth are continuously growing throughout life. Humans do not have that. We are hypsodonts. So you do have the ability, sometimes if their teeth are really worn down because they were eating rocks or really rough forage, and you can feed them appropriately and give their teeth a break, you can tell a little bit more. But often if they're worn down to the gum line, then you don't have enough of that tooth to grow back if you've worn off all of the dentin.
I love the dewormers because you could actually throw the caps at people.
The cold.
I've been shot.
Man down.
Wow. He says, no, thank you, sir.
He's like, I don't care how old you are. I'm in love.
3.5?
I can agree with that.
Eruption date for that second tooth is 3.5. So she's between 3.5 and 4.5. You're little.
To be fair, it actually does take longer with vets.
Yeah.
Not because they slow us down, but because we actually get to do things we don't get to do otherwise. Like pulling coggins and giving rabies and getting an actual medical exam. It's awesome.
I know. Everything is super scary. I think that this one is young and afraid. And looking at its teeth, I would say it's maybe 3. But I'm gonna have Dr. Lydia take another look at it and decide for sure on the age. But it appears that it has its adult teeth on the up here, and then the, I don't know the term for it, but the outside incisors look like they're just coming in on the bottom, and then the top ones look like they're just coming in too. It looks like a young horse.
When we're listening for lungs, we're usually listening for crackles or wheezes, and this colt has an inspiratory wheeze. So when he's taking a breath in, his lungs are kind of going just a little bit on both sides. So that indicates that he has an abnormality in his lungs. Usually we have bacterial infection. Sometimes we can have fungal infection. Crackles, we never want to hear either one. Crackles usually tend to be kind of a worse prognosis. So we're gonna go get some broad spectrum antibiotics for this little guy and get those on board. He also has what could possibly be ringworm all over his face. So sometimes we see dermatology conditions when they have a suppressed immune system, which kind of fits with what we're hearing in those lungs. So we're gonna try to figure out exactly what's going on in his face and get some appropriate treatment on that. Ringworm is not actually a worm, it's a fungus.
Okay.
So we haven't confirmed that that's what this is, but anytime you have direct contact, you can get ringworm. It's itchy and you get little circular, depigmented. It's not cool to get ringworm.
There's a rescue whip for you if you want.
Don't want to do.
What I'll do is I'll just sit here for a minute like that.
Yeah.
And then they usually don't jump as much.
You're super good at that, Corey, so you should do the microchips.
No problem with
I will stab them all day long with the smaller needles. Perfect.
That's a black light.
So fungal infections will fluoresce under black light.
You should get this if it truly is.
Uh-huh.
Really cool. Is it?
Yep.
Woohoo! Sorry. That's exciting for him.
Not completely, but all these little areas,
Oh, wow.
the scabbies, are pretty glowy. So glow is kind of the wrong word, but you know, picture if you're shining it on your shirt and it's bright. So we have evidence that there is fungal disease. We're going to take a skin scraping and see if we can 100% confirm what it is.
Okay.
We've had a really busy day today. We have gone through all of the horses up in quarantine because we have another group of horses coming in, and it's been a challenging day because almost 0 of the horses were halter broken or had been handled at all. So we had a lot of babies, had a lot that we needed to go really slow with. We did have to administer the last act of kindness to one horse. Today, he was a beautiful gelding, but he had some really abnormal mentation. He had some severe back pain. We went through a ton of horses today, did physical exams on everybody, checked teeth, did vaccinations and microchips and dewormer and all that kind of stuff. And yeah, it feels like a balmy 25 degrees now compared to 4.
I am going to be microchipping the litter puppies that we just got. I'm gonna disturb the babies. Come here, Ginger. Ugh. You are Ginger, right? You are Ginger. Good girl. I'm done.
6 more to go.
Yeah.
This is Clementine. Not Clementine. This is Isabel. Everybody got their microchip, and now they can go out into the intake barn with some food, water, and a bed.
John, what's happening to this, to actually my computer?
Yeah, yesterday was Monday. I came to find out that your screen was blue, and I was like, okay, what's going on? And it said I couldn't run the recovery system. I'm like, oh, that's great. So let me try something else. And I kept trying something else and trying something else, and Windows just went kaput. In that event, I decided to take the whole thing here and made a surgery room out of it so that I can actually fix it quickly, because putting it back and taking it and opening it and taking it back and putting it back was time consuming. So this is way easier having it right here. Everything is reinstalled, but right now I'm trying to see if I can get everything that I need to have so that Faye can have the computer back. I'm trying, but it's taking a while. So.
Our volunteer days will take place the first Wednesday of every month from 9 to noon, weather permitting. We will be doing projects like painting and cleaning and other things that will be pretty messy, so make sure you wear clothes that you don't mind getting dirty. At some point in the day, during our volunteer time, you will also get to spend a little time with our mascots Dino and Cowboy. If you want to come and spend a little time at our facility, we highly encourage you to come out to our volunteer day, and we look forward to seeing you.
So we have horses coming in from our buyout program. They have come before, brought us horses. They skipped a step and went straight up to quarantine instead of signing in with us. So we are going up to fetch them because they can't unload the horses until we've counted them to ensure they're telling us the truth about how many they have on their trailer.
So we just had a trailer with 7 horses pull in. I'm trying to just kind of peek in and see if anybody's in really critical shape. Everybody's on their feet. There's one horse that looks like he or she is packed in too tightly to raise up her head. And so she's got a couple of abrasions on her face, but they look to be superficial. So we'll get them unloaded and looked at as soon as we can. So we just unloaded these 7 horses. We've got some mares and some geldings. One of them has a pretty severe wound over what looks to be her hock. Hopefully it's not joint involvement. We've got some snotty noses and some deep suspensory plimdesmitis. Looks like that's kind of all we know right now. These guys were pretty hungry. We've got some hay out and some water for them, and we're just gonna kind of let them settle in a little bit before we do a more in-depth medical assessment. Albany's roof isn't even present, so we're probably in our 30s.
Yeah.
Oh my goodness. It's a 5 out of 6 heart murmur. That might explain having difficulty. You guys should listen to this. You want to hear this murmur?
Absolutely.
It goes duh, 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 duh. So you're only supposed to have 2 heart sounds. You hear how pronounced that is?
Yeah.
Yeah.
Sounds like
So I almost
the last
would
beat's like a snare drum or something.
I almost would grade that a 6 out of 6, the most severe. You're okay. You don't have to get up, okay? Don't think about it. Can we grab a little bit of hay maybe?
Yeah.
This mare was down in the trailer when she arrived. She is probably close to 30 years old. We can't age them super accurately over 20, but her teeth are very smooth. She has a grade 6 out of 6 heart murmur, so 1 out of 6 is very minor, difficult to hear. 6 out of 6 is so pronounced that you can almost feel it from the outside. So she's probably having difficulty oxygenating, especially with the stress of transport. and that's why she's so weakened down. So we're pretty concerned about her. She's also very dehydrated. Step forward a little bit. Good baby. You guys, that is just heartbreaking.
I wouldn't want to walk either.
So we're just taking a look at this horse, and her case is really heartbreaking. So you guys have probably heard us talk about deep suspensory limb desmitis. And basically it's a failure of the suspensory apparatus that holds the leg in an appropriate position. There are two big ligaments, the superficial suspensory and the deep suspensory. And you can see this poor horse's joint is basically fully collapsed, so that instead of walking on her hooves, she's walking on the back of her legs. She's really, really in pain. And so even walking a couple steps out here was hard for her. Even without any diagnostics, we know that we can't surgically correct this. I don't know how old she is yet. She's been very sweet, but she's probably been in pain for a really long time. Super heartbreaking. We're up here at the quarantine barn. We had 14 horses come in today from Kentucky. Thankfully, most of them were stable. They were all pretty hungry and thirsty. We did unfortunately have to give the last act of kindness to 2 horses. One of them was in her 30s and she had a severe heart murmur. She was down in the trailer and we weren't able to get her back up. And then the other horse was only about 16 years old, and she had the most severe case of DSLD I've ever seen. Her joints were completely touching the ground. So that was irreversible damage. So we did give her the last act of kindness
Even in
as well.
all that pain though. Such a
she was
sweetheart.
very
Both
sweet.
Both of them. Sweet until their last second, but they are at peace and not in pain now.
So for now, the threat of icy weather is over, so we're going to be putting everybody back out into their pastures. Kimberly is already working on getting everybody out of the intake barn. I've got everybody separated to where they need to be inside the training barn, so we can run them out. I'm going to go over and grab the list so I know exactly where they need to go.
'Cause I'm always heading your way.
I remember that.
And I know exactly what I'm looking for. And as we grow, I'll keep running till I can no more.
All right, now we got everybody back out. I just need to fill up a couple hay feeders and we are good to go.
We're going to go up to quarantine and evaluate our new intakes. It looks like they had separated out a few crucial ones that we want to head off first today, and then after that we'll go through everybody else.
Keep them busy in the rain. So we're up in quarantine. We actually don't know if this horse is a mare or a gelding. He or she has a really severe wound over a joint. Well, immediately we're gonna give pain medications, and then we're gonna try to assess whether or not there's a fracture associated and whether or not the joint itself sustained a puncture wound, and we'll take it from there. You can see gas coming all the way down here. Mm-hmm. So that's not exactly where we are. We're a little bit lower, but that also just confirms. So actually the joint that it's closer to is the tibiotarsal joint, not the hock joint.
So this was our top priority mare today. We wanted to get her up and check her leg because I noticed she had a wound yesterday when she was brought in. And whenever she moves, she had tiny bubbles and liquid coming out of the wound that was consistent with joint fluid.
With wounds like this, if this mare had been in a stall at an owner's house and we got a call and we said, hey, my mare just got trapped, she has this wound, we can sometimes treat wounds that communicate with joints.
with really aggressive, usually surgical joint flushing, and then aggressive IV fluid therapy and topical fluid therapy. Unfortunately, we don't know any of this mare's history, but this wound is crusty and old and dried out. And the bubbles also indicate that we probably have gas-forming bacteria present. So all of those mean that her prognosis is grave, even if we were to very aggressively treat her. She's also extremely painful. Even with a lot of really heavy pain medications on board, she can barely tolerate us touching the leg, and she's not even able to stand on it. So unfortunately, I think the last act of kindness is what's indicated. And it's really heartbreaking. She's a beautiful mare, and she's only 3.5, and she's halter broken, and it's been really sweet. So.
Yes, that is a mare, and you are very handsome. We're going to take some radiographs of his left hind leg to see what's going on with his stifle.
This little stallion, who's adorable, doesn't have to be rideable. He just needs to eat cookies and look cute, which is great. What we were hoping to do today was confirm whether or not he has something that's going to be painful or require long-term management. And we don't think that he is painful or that he is going to require long-term management. It looks like he has possibly luxated his femur. If he were going to be ridden, that would be an issue, but he's so tiny that he'll probably do just fine with it. So I think he's very adaptable. He just maybe needs to not be a stallion for too much longer.
So we have a complete femoral fracture. This is the top part and the bottom part, and they're not even lined up with one another. This poor horse, and that's old, like months old. This poor horse has been in pain every step he takes for at least 4 weeks, I would say, maybe more. So unfortunately, we can't repair a femoral fracture, and the last act of kindness is going to be the best thing we can do for him. So she needs better dental assessment and a more complete opto exam for the right eye. And I think that she would be a good candidate for surgical removal and repair of this left side. She's got entropion and probably some ongoing pain in this eye. You're a good girl. Dr. Gina got a really good look at this mare's mouth, and she has a parrot mouth, which is just a fancy word for saying that she has an overbite. She's holding her mouth kind of clamped shut, and she's definitely not super comfortable when we're palpating the rest of her mouth. So we're gonna prioritize doing a better dental exam with some sedation, and Dr. Gina is gonna give her some Banamine for discomfort for about 24 hours until we can take a closer look in her mouth.
So we are closing up for today. We got through all 14. We got all the intakes done and evaluated. Some we have figured out that we need to do further evaluation. That will be done later, but everybody is done for today, and we are fixing to go back to the barn.
Hi, I'm Kimberly. I am the vet assistant and animal health and husbandry person here at Horse Plus Humane Society, where we focus on helping horses through any stage of life. We help young horses and old horses, but the plus in Horse Plus means that we also help dogs and cats and just about any other type of animal you could think of. This is Pilgrim, and he is one of the many horses that we have available for adoption here. You're also welcome to apply to adopt a dog or a cat, anything that might be a good fit for your family. If you're interested in adopting, you can visit our website. It's horseplushumanesociety.org. And click on the adoptions tab, and there you can see all of our available animals. And if you're interested in adopting one of them, you can just click on the animal's profile and then click on apply here. And then just don't forget to send your pictures to info@horsehumane to complete your application. Yeah, we look forward to seeing you here.
"21 years of marriage. We had a great anniversary trip celebration, but we're back. And I think it seems like we missed like some really horrific weather because when we left, it was rough.
Well, our airplane was canceled for a day. We actually were going to fly out of Nashville, and the FAA shut down the whole airport. We had to drive to Memphis that night. Tried to fly out the next morning. It was delayed due to icing and low fuel on the airplane, so we missed our. It's great.
We didn't connect with our flight, so we got stuck in Florida, but it was okay. Florida was nice and warm compared to here, so.
And yeah, it was really, really icy while we were gone. We saw pictures and videos, and it's good we left. And then we came back, and now it's warm.
Now, you know, when I'm on vacation, I try not to work, but I couldn't help but look at the thread where we have all the photos. And it looked rough, and I'm so glad we have all the barns. It was just a real relief for me knowing like all the animals were going into the barns where they could stay safe, and so great to have such an awesome team here taking care of everything. So how did you do, John, while we were gone behind the camera? How are you?
He did good.
Great. I mean, it was rough, but I did great.
Good. Now I'll ask other people on the media team how you did.
Yeah. I was the only one here last week.
Oh, yeah. It's a one-man show.
I was able to get the 7 blue heeler puppies transferred out to 2 Rescue in Mount Juliet. I'm going to work here on a little bit and I'm loading them up and getting them transferred out there. And I'm going to continue to work on getting all the other puppies transferred out of here, the 7 lab mix puppies, see what I can do about getting them transferred over the next weekend.
So I'm getting ready to intake the 7 puppies that we got the other day that Dawn is going to be getting transferred out to a shelter. So I'm just going to make sure that they've got their wormer, their shot, and their flea and tick medicine. This is Synergy. It is, put the scissors in the trash can. It is a flea and tick preventative that goes down their back. $3.9 pounds. You're a small little man. You're a small little man. So I noticed that when you pick her up, her mouth hangs open and she almost like freezes and stops breathing. So I don't know if there's an issue with her diaphragm or her lungs or anything like that, but it's almost like when you pick her up, she has a pretty difficult time breathing. So I'd let Dr. Lydia know what I found, and so she is on her way over to take a peek at her and make sure she's okay.
Hi, honey.
But she puked before I gave it to her.
Got a super happy roundworm burden.
Yeah.
Huh? That's real gross. I'm sorry. I can go see if we have any on Dancitron. Hi, seaweed.
Yeah.
Yeah, those are roundworms.
Because when I went to pick her up, and I was like, actually, I'll wait because I don't want to pick her up.
Humans
and
can
cause
get
that
roundworms,
response.
so make sure you wash your hands very well. Hi, honey.
You're cute.
Yeah. She's probably nauseated.
Yeah.
And that indicates a very heavy burden if those worms are.
I pick her up, she doesn't.
Crawling forwards.
Hangs with her mouth open.
Yeah, she's probably nauseated. Hi, honey, I'm sorry.
No.
She probably has like GI discomfort, so the pressure on her tummy is bothering her. You have very beautiful eyeballs.
She does.
Yeah, she sounds fine.
Okay. Just a bad case of the wormies.
Yeah, that's so gross.
Yeah, it was disgusting.
Also, if you just deworm them, they're gonna poop roundworms like crazy tomorrow.
Yeah. So Dr. Lydia came and looked at Miss Sandy, and she's just has a very bad case of roundworms, and they are coming out of both ends versus just the back end. So if she gets any more nauseated and throws up anymore, we will give her some anti-nausea medicine, but they are coming out naturally. It's just not the way we expected them to.
Hi, I'm Jordan. I'm the new receptionist / stable hand, and today we're working on clearing out all these stalls from where the horses were in here over the past winter storm, just trying to stay out of the rain and stay dry. It's not working too well, but we're trying.
We're gonna bring Bowie in. Bowie's a young colt in the training program, and Corey noticed today that he had an elevated temperature and kind of some foul smelling breath. Based on physical exam, it looks like he has an upper left fourth premolar that hasn't erupted correctly. He has a bump from the outside, and I agree that his breath smells like infection. So we're gonna take some dental radiographs and see what we find. Oh yeah, we are very drunk. Your breath is stinky. I don't see
Nothing looks like
active infection, which is great. So then why did you have a temperature? He does have a bump that we can see on x-rays consistent with this bump that we see on the outside of his face, but we don't see signs that that's actually infected. He does still have kind of a stinky smell from his nose. If he lets us, we're gonna put a dental speculum on. That's the equipment that lets us open his mouth. But we've asked a lot of him today, and he's a baby horse. So we're gonna take it really slowly and gently. We're gonna put him on some antibiotics regardless. So we'll see how far we get with that today. But overall, nothing earth-shatteringly terrible on x-ray, so happy about that.
So we just got finished looking at Bowie's mouth with the speculum, and the left side was actually very unremarkable. The right side, we saw a little bit of a wave, but best case scenario. And we're just gonna give him some antibiotics and then put him back.
So the day before Thanksgiving, Fiesta decided that she was an Olympic jumper and tried to jump a panel very unsuccessfully. Today is an exciting day because it's 2 months later, but she is finally ready to be turned out. And Dr. Lydia is gonna give you a medical update.
So we're really happy with Fiesta's progress. She's had all of her really deep wounds healed. She has no ongoing infection. And we were concerned initially that she might have long-term lameness issues, but she's doing very, very well. So she's getting cleared for turnout today. We're gonna give her her rabies vaccine, and she'll be fully up to date on her vaccinations, but she gets to go outside and be a normal horse again. So fingers crossed that she doesn't try to jump out of our pretty high pastures again. Have fun.
Hey, run, Fiesta, run. Fiesta is finally outside. She seems to be very happy. She's making friends and or enemies with her pasture mates right now. I think it's just been a long time since she's been with other horses, so she gets to run around and learn how to be a horse again.